So are you unsure which pro-aging skin treatment is right for you? So my question is, why are you trying to choose just one? Why not have them all in one treatment? I'm going to share with you my pro-aging skin treatment that I do in my clinic for men and women who want to look younger naturally after the age of 50. Now, this is a combination treatment of the main premium treatments that I do, which is microneedling and HIFU, so high intensity focused ultrasound. I'm going to demonstrate through a pre-peel and then a targeted mesotherapy papule with the nanosoft needle, and then complete the treatment with the LED canopy or the red light therapy to stimulate the cell rejuvenation and generation of collagen. Interested? So watch me complete this treatment on Steve. Now, I've not done it in real time, but you will see how layering the treatments enhances the overall sort of skin rejuvenation experience. So for the best skin health expert advice for my in-clinic skin treatments and take-home skincare tips and advice, subscribe to my channel. Hit the bell to be notified whenever I post a new video. And when watching my videos, please give me a like, just to let me know, like a thumbs up, or if you have any questions, then do make a comment, as it will be me that answers the questions. So ask away. So who am I? Well, I'm Jen Adams. I'm a skin facialist and a nutritional therapist. So I call myself a skin health expert. Now, my skin treatments and my nutrition advice gives you an overall functional health approach to pro-aging. So let's get into this and watch me layer these skin treatments on my Steve. So HIFU Plump Plus, Skin Peel, Microneedling, Mesotherapy and the LED Light Therapy. Pro-aging skin treatment, it doesn't hurt, there's no downtime, and this is for men and women. Now this is my Steve, he's 55, he loves the sun, a bit more than SPF, simple skincare routine and a pretty good diet. It's his crow's feet and his under eye wrinkles. He always nags me. I don't like his neck creases. That's always what I see. So I always like to focus on those. And you can see the loss of volume there just underneath the cheek. The kind of fat pads have sort of started to waste away. So that's another area that we're looking to improve the volume. So at the moment, all I'm doing here is adding the ultrasound gel to underneath the eye area. This will be for the skin tightening and also increasing the volume. I'm just looking here to see where areas to avoid with a HIFU on his forehead. Just double checking those. And then I'm just going to put a little bit of gel on the eye. I like to do a bit of an eye lift with the HIFU Plump. We always start with the HIFU Plump because it's deeper. It's much deeper than any of the other treatments. So this is my 2ml cartridge. It's actually a macro-based energy. And for this pro-aging treatment, I'll be aiming to do about 200 shots around the eye area. We go one after the other in kind of lines really of between 5 and 10, working downwards away from the eye. And just there, going to scoop under there to help improve the volume. You can get right into the crease and get some skin tightening going on there. Now, the reason I use this 2ml macro energy based HIFU with this pro-aging type treatment is that it's pretty instant. The skin around these areas is very thin, so we're not looking to go too deep. The 2ml, as it suggests, is hitting the skin at that maximum depth of 2ml. So I'll work through both sides, and you'll see me then go over the eye and lift the brow a little bit there. It just gives an overall firming, particularly around the eye area, that most people are looking for. You don't do the actual eyelids, obviously, for obvious reasons, but I can lift and get as much purchase as I can around that skin. And then I will then just repeat on the other side, and then repeat again the whole process. So I'm going back over the same eye, pretty much going over the same lines that I did previously and working my way around the eye area. And then I will then focus a little bit there, you see, on the crow's feet area as well for him. So that's quite a pleasant-ish type treatment. You can feel it, it's sparky, but it does not hurt. So now, staying at the same depth, I'm just looking at the skin elasticity or laxity around the neck area. Now, Steve often complains to me about under his chin. He's quite a thin chap, so he's getting this sort of waddle under his chin. So we're going to do a little bit of HIFU here with 3 mil. This is deeper than the 2 mil, obviously. So we're going to go deep under here, and again looking to go down in a row and keeping the energy quite close on top of the ultrasound gel to protect the skin. Not going over the thyroid, literally just on the what I would call the looser skin, and doing like a fan type treatment where I'd then go down those 2 sides, and you're looking to create this sort of structure and a firmness under his skin. Now when I say this is a layered treatment, that's what I mean by going deeper first and working my way up. So you'll see in a moment I will do another layer over the top of this with the 2 mil as well for the instant tightening. But this is what I would call on a loose skin. So I do a 2 mil 100 shots under the chin area. A lot of people ask me about that. If you had a little bit of fat under the chin, I would go even deeper and actually go down to a 4 mil, then the 3 and then the 2. But anyway, Steve does not have that problem. We are just looking at the skin. Now to create a structure, I will come up with the same mil up his cheeks. Now, not as many shots, but I'm just looking to provide an element of structure, because your neck doesn't just hang, it comes from your jawline. So hence I'm putting a little bit of energy up to the cheekbone there, not wanting to break his fat pads down any further, but wanting to provide a deep level of firming underneath those cheeks. A, to support the eyes, but also to help lift that chin area. So this doesn't hurt, but you do feel it. It's quite sort of sparky, as I would say. So once I've done a pass, as what I would call coming upwards, I would then do a second pass going long way. So you're kind of zigzagging. Here I am now with the 2 mil. Now, as I've said there, I can now go over the thyroid and I can go over the throat with this 2 mil because it's not as deep and it won't cause any damage. This is just the instant skin tightening cartridge, so similar to the eye area. So yeah, I think I'm taking the gel off now and we're getting ready to prepare the skin and sort of moving now into the more skin rejuvenation. So I'm going to clean the skin with a pre-peel solution, and this enables me just to clean off any debris and also to drop your brush there, Jen, or also to drop the pH of the skin just down to 4. And there we go, look, I've even said it on the notes, look at that. I like to use these brushes. It puts a nice thin layer on top of the skin and evenly spreads it out, especially with the chaps. Make sure you always go deep into the hairline. And then I like to remove as much excess as possible with the cloth, because we want perfectly dry skin when we're applying a more active peel. You do not want that peel to be reacting with any water on the skin. Again, different brush, but I'm now just going to paint on this skin peel here. Now the peel I am using is bright peel because Steve has quite a bit of pigmentation and sun damage and some dark spots, so I'm focusing on those for him. You will notice later I do a slightly different peel for his neck. I will explain. Oh, there I am. Light peel on his neck. The thing I often find with men is they get a bit of a rash on the neck, just where their collars sit. Higher than that, Jen. But basically, to drop the pH of your neck down as much as your face, it causes an irritation. I like to do the backs of the hands as well. It's always a bit of a giveaway, and it's often missed. I'm a bit obsessed with backs of hands. So for 3 or 4 minutes we wait for the 2 peels to do their magic and dissolve those dead skin cells, and then I manually then just apply the post-peel solution. This brings the skin way back up to a pH of 8, and again looking to just to clean away any excess peel so it's not sitting on the skin for any longer than it should be. Now my NCTF 135HA serum, catchy, love it, it is amazing. So this serum is a mesotherapy based serum and is from Filmed, as you know, my massive fan of my Filmed products, and this is now me doing the microneedling. Always start on the jawline, it's the way I was taught, it's what I always do. and we're talking a depth here of 0.75. You can't always get it 100% bang on with these devices. It's between 1 and 0.75. That's all he needs on that jawline there to do some collagen induction. So as you can see, I'm sort of doing what am I trying to say, lines. I'm not swirling, I'm not creating any blood, but I am being thorough and working on a cross hatch situation at that depth on the jawline, pushing that product into the skin and placing it just at that perfect depth. There we go. I'm going to reduce the needle down there to go over the nose, often makes people sneeze, and gently working around the eye area. That cheek can be quite sore sometimes. I am going over, you know, a couple of times, but not rubbing. So this is a 0.5 depth on the sort of slightly thicker skin on the cheekbone and around the eye area. I like to apply more serum as I go. I like to go back over the area I've gone. It tingles a little bit. Now I often reduce the needle down again a little bit further when it comes to the forehead and really within the eye area, down to about 0.25. With men, I go into the hairline, and ladies to be fair, also if they've got thinning hair with thyroid issues, you can work right through the hairline. I have a particular client and I literally do his whole head, you know, so that's a whole nother treatment. But microneedling through the hairline, over the brow there, over those veins, absolutely fine. Pushing that product in deep and stimulating this cell rejuvenation or cell regeneration. So I'm now adding a bit more serum. Love doing that. It helps give a glide as well. He has no painkiller stuff on him. It's irrelevant. Don't need to when you're going at this depth. This to me is the absolute yes, putting the serum on. This is the perfect depth at sort of top of the dermis, deep in the hyperepidermis layer of the skin, and getting those little junctions to keep the skin firm and lifted. Under the neck, around the back of the ear, get those areas. They're so important, especially on men or ladies with very short hair. Often gets missed off. So working down the neck, sometimes I will mix the NCTF with maybe a hyaluronic acid as well, because we lack hyaluronic acid on the neck area more than in our faces. It's just the way it is. The skin is slightly different. And then look, I'm working down the other side again, cross-hatching as I go. I think I've sped that up. I mean, I'm quick, but that looks really fast. But anyway, over the throat and all the way up. He's wincing now. See him? He hates his neck being done. Hence, I did this slightly softer peel, or lesser pH of the peel. Right, so this is my mesotherapy. This is me using, look at that, flooding into that eye wrinkle there. Isn't that beautiful? Look at that papule there. Pushing the product in. So that now is placed at 0.6 depth in the wrinkle area. I'm using this fancy little nano soft needle just to pick up the skin there and create these little papules around the eye. Now this, as I say, is a treatment all in itself. However, I can target this and I can flood the areas that are important to the client. So literally just a couple of papules in those wrinkles that they hate the most. I've done full treatments where you go underneath the eye and you can do 2 lines of this all the way underneath the eye area as well, which I'm sure I'll show you in a separate video. But they are the papules. Now they will just dissolve into his skin and they place the product at the perfect layer within the skin to create the fibroblasts, which will create and give the skin the ingredients that it wants. It gives it the cytokines, it gives it the peptides, it gives it the nutrients that they want to recreate those cells. His wrinkles will not disappear, but the depth and the severity of them will be dramatically improved. So I'm just going to skim through this, but I'm just then going to work around his eye area, just adding in those papules there that then just flood down into the skin. So I'm literally pushing in the product into his skin, and as I say, working through into the tear duct as well, and I can do a whole treatment on that if that is their, you know, if that's your main skin concern. But it takes me about sort of 5 or 10 minutes to do each eye, so sort of bear that in mind. It doesn't hurt. As you can see, there's no blood. He's asleep ish at me. That's it. Oh, look at that going in, flooding. And those are the ones there at the side have literally disappeared already. It's amazing. how it just disintegrates or just dissolves into the skin cells. I call it skin filler. I love it. So this is my mesotherapy treatment targeted on the eye area. Now, the reason I'm doing this post HIFU, post microneedling, is because of the depth that I'm at. This is about 0.3 to 0.6 max. Okay, so it's much shallower than the microneedling treatment that he's had. So we're coming through the skin from the bottom up. Look at them, they've already dissolved already. You can also work around the frown lines as well. Now, you tend not to get so much sort of blanching because the skin is a lot thicker on the forehead, but I'm just pushing that, I'm nearly running out. Look, I'm just going to push that product into his frown lines, and again, it just helps to flood that crease within the frown lines. This isn't a filler, yeah, this is just product going into the skin and feeding the skin. This is kind of like, it's like a multivit or a supplement that you would take in my nutrition world. Literally doing this in the skin. It's delightful. There's a little bit of blood there. Don't tell him. He's none the wiser. So that's it. On goes the hyaluronic youth mask. So nice after the needling. It doesn't go very red, but he is a bit sore. And we peel that off, and these always make me giggle because they always look like little ghosts. Rub that in. Make sure you can see. Oh, so nice, those masks. Now this is made from the cellulose product, say that correctly. Oh, there's always a little bit extra in the packet, so I'm just putting that in his little neck there because it's often a bit sore. And the LED canopy is due to arrive any second now. Now the great thing about this mask, and only this mask, is the LED light will penetrate through this product. No other mask, okay? Most of you know this now about LED light, but he will lie there potentially from 10 up to 30 minutes, and that mask then is quite hard to get off his skin. And that's it. All I'm doing there is just dabbing gently any excess product, just so it's comfortable for him when he gets up, that he's not feeling claggy with that mask product. I like to put a bit of B3 recovery cream on. It's just a nice sort of niacin, nice sort of thin light cream, and then I put the SPF on, but don't tell him. Keep it really simple. Don't over fuss the skin. Just leave it. Just kind of give it a little bit of nourishment and move on. That's it. Right, he wants to go now. Stop fussing, he says. Beautiful. Can't help myself fussing around the eyes there. Anyway, so that's it. That's all the treatments. All done. Oh look, a little head massage. Oh. Before and after. Look at that. Can you see? And that's just the instant flooding of that eye area there. And let that run twice there, just so that you can see. See, back to me. Now to finish, this treatment, as I mentioned, takes between 75 and 90 minutes to complete. And I will repeat this treatment again in 2 weeks, and then a third treatment 2 weeks later, and then the final fourth treatment will be a further 4 weeks later. So in total, 4 treatments over 8 weeks. Now, some clients like to keep moving forward with their skin treatments and like the kind of pro-aging approach that I have, which means I would continue with this type of layered treatment every 6 to 8 weeks. Or if you're busy and you just want to maintain your skin tone and the quality of your skin, then you can repeat this treatment, say, every 12 or 18 months, as that's how long the effect of the overall skin protocol will last. So to help you to decide if this type of treatment is right for you, I've created a skin health quiz, and it will give you a score out of 10 on the quality of your skin health. Click the link in the description, which will take you straight to the quiz. Answer the 10 skin and lifestyle type questions, and if your score is over 6 out of 10, then yes, the quality of your skin health will benefit from this type of treatment, as long as you have realistic expectations about skin treatments. If below 6, we need to address your skin home care treatments first to help you move forward, because the quality of your skin means that you would not benefit from such an intensive treatment at the moment. Once you've got your score, come back to the channel and check out the rest of the skin health tips in the playlist to help you. Now, if you like what you learned from me, then please click the like button and make sure you subscribe and hit the bell to be notified when I post my new videos each week, and share with someone else who you think would also benefit from what I do and how I do it. Anyway, if you don't, then I'm really sorry about that, but thanks for listening anyway, and you can always click the dislike button. Any reaction's a good reaction. And remember, invest in your skin health, not just your skincare, for younger looking skin naturally, especially after the age of 40. Thanks again. Bye.